Fabulous, but we were due to remove 3 of your wisdom teeth, so the 2 bottom ones and the top left one. Sharp scratch, okay. Bit of pressure here just to test the tooth. A lot more pressure here. You're doing great. That's it out, okay? So there's going to be a little bit of drilling with this one, okay? So vibration and water. So it is moving very easily. Yeah, you've got cute little teeth. I'll show you them at the end if you want. A lot more pressure on this side. Just a couple of stitches here. You can breathe a sigh of relief now. All the hard work's done, all right? We're ready for you, Min. All right. Yeah. Oh, thank you very much. Yeah, I mean, I don't wear this all the time because I always like you've got your NHS scrubs and your private scrubs. But it's just, I've got a couple of different colours.
I keep saying these all the time, but
I know.
Gross.
Yeah.
And I can't walk home, like I can't get on the shoes and stuff like this. I mean, I always but it's like powder.
Yeah, you feel a little bit grim, don't you? I have to change out of mine, I can't, whenever I'm coming and going from work as well. But do you want to pop your belongings? Sorry, there's a little hook up here, and then you can have a little seat. Have you had some breakfast this morning? Yeah, fantastic. Have a little seat there, Min. No, I'm just going to run through the general things. Of course, I haven't seen you as a patient before, so we'll just double check. But you're medically well?
Yeah.
No allergies? No. And not taking any medication?
I'm on levothyroxine and duloxetine.
Yep, and that's everything?
Yeah.
Fabulous. And do you smoke or vape at all? Vape. I'm going to really encourage you not to. I know it's addictive, but after an extraction, it can have, there's not enough research, but it can have a similar effect to smoking. So we prefer you not to smoke after the procedure, just because we know smoking doubles the chance of getting something known as dry socket, which is essentially an infection of the wound after the teeth are removed. It can be quite severe pain around day 3 or 4 with a bad taste and a foul smell. So we're here, we're at the other end of the phone if you need us, but we know it doubles the chance if you smoke. So vaping may have a similar effect. So we'd prefer you not to for a few days. Cool. All right. A lot of people are like, oh, I might as well quit then if that happens, but we'll see how it goes.
Maybe.
Fabulous. But we were due to remove 3 of your wisdom teeth. So the 2 bottom ones and the top left one.
Yeah.
As well.
Yeah.
I'll have a look, we'll confirm everything. Now, I don't know how much Zyme went over your x-ray with you, but I'll run through everything and give you the options. Essentially, with our lower wisdom teeth, there is a nerve that runs closely underneath them. It supplies the feeling to the lip, chin, cheek, tongue, and gums of that side of the mouth. But given that it's both lower wisdom teeth, it could be both sides of the mouth that could be affected. Yeah. If when we're taking these wisdom teeth out, that nerve is stretched or bruised. And the risk is that could lead to long-term permanent numbness, altered feeling, change in sensation like pins and needles, or even altered taste to the side of the tongue, if it was nearby and if it was stretched or bruised during the procedure. So we have options to reduce that risk. One, we can look at the x-ray and say, okay, on the left side, it's not as close to the nerve as it is on the right side. You can do nothing, but I'm sure you want to intervene to get rid of your symptoms. 2 is just to cut the top of the tooth off, so the crown, leaving the roots behind, because it's the roots that are close to that nerve. So by not interfering with the roots, you're minimizing the risk. However, it has the downside of the roots are left behind. They might cause you symptoms in the future, particularly if they migrate up through the gum, pierce the gum, cause symptoms like pain, discomfort, sharpness as it pierces through the gum. So that's the downside. But at least then at that time, it would have moved away from the nerve, reducing the risk of nerve injury. Or we can have the option of taking a 3D scan, so a CBCT, and that gives us more information to know exactly where the nerve is in comparison to the tooth. Now, that doesn't mean that it eliminates the risks whatsoever, but it gives us more information so that if we do need to drill and cut around the tooth, we know where the nerve is, keeping it as safe as possible so that we can put our instruments and surgically plan essentially our treatment. So that's an option that we could do for you today. If you prefer the option of extraction, then that could be a good option for you.
I don't mind.
Mm-hmm. Or we don't do any and we go ahead with the extraction, but it will give us more information.
Oh God, that's too many options.
I know, it's a lot.
I think whatever.
Yeah.
People hate saying that.
No, that's okay. That's okay. If it was my mouth, I would go for the 3D scan. Having more information will always guide us, and it can tell us actually it's so far away from the nerve that the risk is minimal, or it's very close to the nerve, go for coronectomy. Or we know where it is and we take the tooth out. So I think it just gives us all the information and then we can proceed from there, if that's okay. But in the meantime, as long as you are sure you want to go ahead with the procedure, either way, we can numb the area so that at least we've got it numb. By the time I've had a look at the scan, it's ready to go. Is that okay?
Yeah. I'm not bothered about numbing.
Fabulous. Okay, let's have a little look and then we can go from there and get this done. All right. Great. So what have you got planned this weekend? Is it going to be a chilled one?
Literally nothing. I've got my dissertation to do this week.
Oh, yes.
Well, I just need to kind of like start putting my data together, start doing data extraction.
Yeah, well, we'll maybe edit that out. But let's lie you back here, okay? Happy. Could I just get you to slide up the chair a little bit more for me, please? Yeah, buns always get in the way, don't they? Lovely. You get yourself comfortable.
I'm doing my local anaesthetic section on my degree at the moment.
Oh,
so
so
this is actually really exciting.
Oh, that is so. That's nice to hear. Now you can kind of relate whenever you do have to give anaesthetic in the future. Let's have a little look. Okay, so that one's just peeping through the gum. Okay. And so is that fine? And have you had symptoms from the right side?
I don't think I have, to be honest.
Okay.
I can't remember now. When I came in for that one.
Mm-hmm. You can't.
And that one. Yeah, I don't think I've had it too much on that side, but then I think we kind of considered that if I was going to take two of them out,
get the other one.
Yeah.
It is impacting against the tooth in front in the direction of the tooth. And if food gets trapped there, or bacteria can get down the side, it could compromise the tooth in front. Mm-hmm. Whereas if your wisdom tooth was angled backwards or upright, that's less likely. Yeah. And therefore intervening, it could be more just monitoring. Yeah. So I do agree that it's probably best to intervene. Okay, but let me just have a little feel there. Yeah, and there is a pocket there. So food could get down there, even though you've got a really clean mouth. You know, it is a risk, and we don't want you to lose the other tooth, you know, by not intervening. Okay, so are you okay with a little bit of topical first, just to take the edge off the anaesthetic?
Yeah,
yeah.
Sure.
Lovely, so I'll pop that there. Yeah, I'm going to do the numbing first. And then we'll do it, yeah, because we're going to do treatment anyway. Could I get one more pledge, please? So it's going to be a few injections per tooth. We want you super numb. And then we'll check it's obviously really nice and numb. During the procedure, thank you, you're going to feel a lot of pushing and pressure. We can never take that away. Let's pop this up at the top. So. And if you close now, we'll just let that sink in, and then we'll get the anaesthetic ready, okay?
That's got such a specific taste.
Yeah, yeah. And the thing is, when it lingers and you swallow, you probably will feel your throat go a tiny little bit tingly. It's all okay. Everything is working. It's just the anaesthetic doing its magic. This always makes my gloves really slippery, so I'll just change them. Oh, why? People tell me about getting it in their toe or in their eye.
Oh my God, no.
Yeah, I know that. I think I could manage with any of them. You know, you get on with it, but I cannot imagine that. Like, that must be. Yeah, yeah.
When I had laser surgery.
Oh, they have to do it in the eye.
But it's not needle, nothing. It's like drops.
Oh, of course. But then someone said, oh, I've had it in my eye. If I can do that, I can do this. I am actually thinking about laser. My sisters have had it.
And it's the most amazing thing I did.
Oh, really?
I was with glasses, now I forgot.
Uh-huh.
It's already like 5 or 6 years.
Yeah.
Do you wear contacts now?
I wear contacts, yeah. I actually had an optician appointment this morning. I would, like, they don't bother me. The only time it bothers me is if I'm going away and I have to bring the solution, the contacts box, and I'm so worried that I'm going to lose them during, like, the holiday that I need to bring, like, a few extras with me. So I'm considering it. But I'm getting to that age where they say you should kind of do it now to get the real benefits off it. So maybe a 2026 thing. Maybe.
Yeah, I recommend the artists to come to my country to do it.
Oh, really?
2,000-3,000. Here, when I went, it was like 8,000, 9,000.
Oh, my goodness. It's much less.
I'm very good doctor.
Well, you have the contacts, so maybe I need to get them details off you. All right, I'll take this out for you now. Alrighty. So we're going to start at the bottom, right at the back. Focus on your breath, nice and steady, slow breaths, okay? So when you are ready, sharp scratch, okay? And again, well done. Good, well done, you're doing great. Is that okay?
It's honestly so fine.
Oh, good. You had it for fillings before?
Yeah.
Yeah. It's good to know.
We did my DVD one.
Ah, there you go. Oh, so you've had one before.
No.
That's that one, yeah. Sometimes people don't do that for fillings because a lot of patients really don't like that one.
And it's when the anaesthetic hits the nerve, it's actually the bit that hurts.
Yes, exactly. And then you have to retract. I'm going to do the same one on this other side, okay?
Yeah.
You can raise your chin up a little bit. Lovely. Same again. There we go, well done. Have a little breather. Thank you.
It's definitely feeling well.
Yeah, is it working already? Good, that's what we like to hear. And again, this is just going next to the tooth this time. Some are a little bit pinchier than others, okay? Well done. And a little bit more scratchier, but not for long, okay? Excellent, super.
God, you're so nice when you talk to her.
Oh yeah? I'm glad. Some people are like, I don't want to know anything, don't say anything to me. I'm like, I need to tell you a few things.
I feel like when we do it, we're just like, this is going to be uncomfortable. And then we just kind of hope that they don't notice how uncomfortable it is.
Just get on with it. Bit of tough love.
Yeah.
And again. You're doing great. And that sharper one a little bit further back. Great. Then we can move on to the top one. Hopefully just a couple more, okay? Thank you. That's great. Yeah, these pesky wisdom teeth, we don't have any space for them, so you know this is why we have to take so many out.
Yeah, and if I'm getting one or two taken out,
get it all done in one go.
Yeah.
Yeah, exactly. One recovery, it's done. You don't have to think about it again. Now, if you could raise your chin nice and high, okay, turn slightly towards me, and we're going again right at the back, okay? Now this one is going to be short and sharp, okay? As big as you can go for me. Turn a wee bit to the middle this time. Lovely. All right, 3, 2, and 1. Excellent. That's the nasty one. It's done. It's out. Okay. You all right?
Yeah.
Excellent. Fantastic. So I'll pop you up in the chair and then you can have a little rinse if you... Oh, sorry. If the chair wants to bring you up, that is. Oh, have you pressed it? No. What is going on with this chair? Sorry. There we go. There is a little rinse over there and some tissue for you. And then we'll get the scan. So you're going to feel super, super numb, okay?
Yeah.
You don't look any different. It's just the numbing. It's like rubber, isn't it?
Yeah.
But no, you look exactly the same. So just mind your step. We will take you in to get this scan, and then I can have a little look at it in the meantime. Fabulous.
I'll take the glasses slightly dizzy.
Oh, you okay? Do you want to pop your head back a wee sec? Yeah.
I do sometimes get dizzy.
Yeah.
You want to drink some water? No, I'm fine.
Yeah.
Okay.
No, it's okay. It's okay. I don't want you to rush and get up though, because if your blood pressure gets low and then you stand, you could go. So let's make sure you're okay before you get up.
Sometimes, I don't know if Jake's told you, I've like passed out like 3 times in the queue before when I get hot.
Oh, really?
Yeah.
God. So it is quite common then for you to go.
Not with like needles or blood or anything, but I think I'm okay.
Are you sure?
Yeah.
Yeah. Put your feet firmly on the floor. Make sure you're not like jelly, and then just mind your head when you get up. Yeah, you sure?
Yes, I think
Good,
so.
good. We're here if you need us. All right.
Cool. Right, we'll do this. Take those glasses off. We'll sync that up to your phone for the music while we do the instructions. Cool. Right, come around this way. You did this before.
Yeah.
So chin on here, front teeth into that little groove.
There feels some error over it. It's not the way to do it. Beautiful things.
Right, cool. Just stand back. Just come outside. We'll just reset this. Thank you. Yeah, cool. Yeah, come on.
Oh, sorry. Come in. Yeah.
Good. Perfect. Hold on to these handles. Nice straight back. Is your chin resting on that?
Can't hear your phone.
Bring your teeth back a little bit. Back a little bit more. Just open up there. And back a little bit more. Just inside groove. Yeah, there we go.
Yeah?
Yeah, brilliant. Oh yeah, because you're really numb as well, aren't you?
I can't hear a phone.
Brilliant. Perfect. Cool, right, it's going to go around. Don't follow with your eyes, just stay nice and straight there.
I know. That's what was happening before. If you want to do it, it's something difficult.
Cool, brilliant. Right, you can step back. Cool. Just exiting the waiting room. Alice will go through it and we'll call you through when we're all ready for the...
That waiting room.
Are you in the waiting?
Yeah.
Thank you.
Cool, actually, through.
Yes, I know she's numb, so is you okay to bite down, okay?
Yeah.
Oh, bless. Does it come over instantly?
No.
No, it'll just be a minute.
We're going to the same as X-ray?
Yeah. This one?
Or we do again?
The whole thing, yeah. Oh, sorry, my love. Yeah, so we're definitely going to need the blade. You've got it, yeah, brilliant.
It won't let. Because I know some of the rooms don't let, but definitely
Mm-hmm.
science don't let it.
It should do, yeah? Oh, sorry, man. OPG or your CBCT nearly almost always cuts it off.
But yeah, trying to get both is hard, isn't it?
Yeah. So it does contact it a little bit, you know. And then on this side, this is why I don't. There we go. And it's just there. That's the left side fine. That's minimal of that one.
Kieran?
Yeah. Okay. Okie dokie then. All right, make yourself comfortable. Feeling numb?
So now.
So numb. Especially when you have it on both sides on the lower, you're just like, all right, where's my tongue at? What is going on here? All normal. So the scan showed on the left side, which is the symptomatic side, it very slightly touches the nerve as the root goes to its tip. But it's not a high risk sign. And because you've got nice thin roots that go inwards towards one another, it's quite a predictable root. Therefore, it's not, I wouldn't expect it to be a difficult extraction. It's not wrapping around the root, so I put that at a relatively low risk of nerve injury.
Okay.
Right side, as we expected from your x-ray, it is closer. There is a little bit of change in the nerve channel as the root touches the nerve, but it's not significant. But if we were to put it in perspective to the other side, this is showing a closer, more intimate relationship. But once again, you have quite predictable roots and small little roots. So it's still on the lower side of nerve injury. If it was going to say extraction, definitely on the left side. On the right side, it's up to you whether you want to leave it, go for the coronectomy, just chopping the crown off, leaving the roots buried under the gum, or have an extraction, knowing that that is slightly higher risk of the nerve injury. But you can still go for the extraction if you feel.
Oh, I don't know. What would you do? Oh my god, I can't speak.
I know, you're so dumb, bless you.
It's so funny.
The only other thing to consider is that because you do have those little thin roots, if we were to do a coronectomy on the right side, there is a chance that those roots become wobbly very easily. And if that's the case, we can't leave wobbly roots behind because we know they will become symptomatic. So it may be that during the procedure, we see how it is. You can make the decision intraoperatively, essentially. So if we were to cut the crown off, and we know already, because we'll start on the left side, that you've got little easy roots, then it may be that actually we can mobilize it really simply, knowing that as a result the risk is low. But if we do find that that side's more challenging than anticipated, then we would err on the side of caution with the right side and maybe leave the roots behind just to be extra careful. Okay, but obviously you're awake, so I can talk to you throughout it and give you the option. And if you change your mind, you can just let me know. It's different if you were sedated or asleep. We need to make the decision right now. Okay, but we'll start on the left side, like I say, and go from there. Okay. Now I know you'd have read the consent form and we went through everything before, and this is not to worry you, but it's just to inform you of what to expect after a procedure like this. You're going to be bruised and swollen, okay? You may wake up tomorrow looking really ballooned out, okay?
Can't wait.
That's the side effect of wisdom teeth removal, how glamorous and lovely that is, okay? But just so you're aware. And we'll run through the do's and don'ts at the end with you, but ice packs and things are going to be your best friend just to reduce any swelling. Your jaw, as a result of any swelling, will be a bit strict on opening. It'll be a bit tense. You can't open as wide as normal, so it will be very much a soft diet. And bruising around the cheek underneath the chin, quite normal. But we'll go through the signs of the infection. Like I say, no vaping. It is more common in smokers. It still can occur in about 10 to 20% of patients and more common in women. So please closely follow our aftercare instructions. And it's not abnormal to have a little bit of sensitivity from your neighbouring teeth until everything settles down, heals and recovers. And we'll pop some stitches in as well, which dissolve themselves in 2 to 3 weeks' time. Okay, so you don't need to come back and get them removed. All right, shall we get done? Lovely. Okie dokie. Let me pop my gloves on. We'll give you your glasses back and then we can get going.
Glasses, please.
Oh, sorry.
Just let me know about what you need up or down.
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 Have you chosen a certain playlist? Chill jazz, oh nice. Good choice. And am I right in saying you were away recently? Were you in Lisbon?
Yeah.
How was that?
Really good.
Have you been before?
Yeah, Jake went a couple of years ago,
Mhm.
and so did I.
Mhm.
And then this time we were seeing our friends that lived there, who had like private beaches.
Private beaches. I can still understand you amazingly.
Well, you've seen that before.
So some private beaches and things. Oh, glorious. I love Lisbon.
It's so nice.
It's funny because, like you said, I've been, Sai's been, but we've never been together. So
Yeah.
they'll have to take that off someday.
Yeah.
I'm going to allow you back here, okay? And I may just get you to slide up the chair again a little bit. You're quite small on that chair. Okay. I swear this chair hits me and I can never get it to... Yeah. It's always like jumpy, so sorry, it's not a very smooth ride. Lovely. Now, can I get you to raise your chin up again for me? I'm going to just double check you're really nice and numb. Like I said, you're going to feel a lot of pushing and pressure. Cracks and crumbles, these noises are expected. Please don't let them alarm you, okay? But if you need me to stop, you need a break, simply raise your hand.
Okay.
Okay? So, let's have a little feel. Anything sharp? Anything sharp? Onto the top, anything sharp? Anything sharp? Little bit there. Okay, no worries. We can always give you a little bit more. All right. And fabulous. Could I get just one more? Light again, please. So at least you know what to feel and what you shouldn't be feeling. So we'll just give you a little bit more up there and then we'll be good to go. We're starting on the bottom one anyway. So if you tilt towards me slightly, now close a tiny bit. Just going to really pull your cheek. Good. And again. Okay, lovely. We'll let that sink in, okay? Okay, so we're going to start on that bottom one. I'm going to stand on this side for you, all right? Thank you. Okay, so big wide mouth for me. And like I say, lots of pushing and pressure. This is where I'll wiggle your nose a little bit, I'm afraid. Good. Lovely. And just try and keep your mouth as wide as you can for me there. I know it's easier said than done. You okay? Mm-hmm. Good. You focus on your breath nice and slowly, does it? Good. Could I get the Mitchells, please? Or the excavator, thank you. Great. A lot of pushing and pulling. Ignore all of the noises. All right. A lot more pressure here. You're doing great. And again, more pushing. It's all starting to move nicely. There we go. It's coming. That's it out. Okay. Mm-hmm. How are we feeling?
Good.
Yeah? Yeah, I know it's an awful lot of pressure. You've done brilliant. We're just going to give it a thorough clean, okay? And then we're going to pop a stitch in there. You can always have a break if need be, okay? Could I get some saline, please? I can hold that, yeah, brilliant. You can rest your jaw for a wee second whilst we get that ready for you. It gets tired quickly.
I know.
But no pain at all?
A little bit of an ache, but...
From the jaw or from the tooth?
Yeah, from the jaw.
Yeah, all right. That's why I'm always supporting your jaw, and that's sometimes where you feel more of the pain by me holding it. But you just let me know if you ever need me to stop, okay? Thank you. So just a little rinse with salty water, and then we'll close it over. Maybe you just suction a little bit further in there. Lovely. Thank you. Another little tug here as we clean off any of that tissue. Yeah, you just suction that for me. Thank you. And again. Okay. I'll give you that as well, please, to hold. There you are. Thank you. Just a couple of stitches here. Be happy to snip. Thank you. And one more. And again. Thank you. There we go. All right. How are we doing? Yeah.
Hi.
You happy for me to proceed with the top one now? Yeah. Lovely. I'm going to just start on that side and then pop straight over, okay? Nice. Lovely. So when you're ready, just chin nice and high for this one. Great. Turn slightly my way. It's a bit of a mouthful for this one. Get right to the back, okay? Good. I'm just going to bring you down a little bit. And then I'll swap with you, Vicky. Now close a tiny bit for me. Just not fully, a little bit open. Yep, there we go. Turn away from me slightly. Great. A lot more pressure now. You've got this, well done. Excellent. Okay, it's almost there. This one won't take as long. Excellent. There we go. It is out. Are you okay? Just going to give it a little clean like before. Some scraping noises are expected. Good. And if you open nice and wide for me. It's looking good. Okay. I'm just going to pop one little stitch up there and then we'll move to the other side. So 2 out of 3 are done. That's the good news, okay?
Mind if I rinse it though?
So you can't spit after an extraction
Okay.
because it dislodges the clot. If you want to have a sip of water, that's okay.
Okay, can I do that?
Yeah, of course, yeah, let's set you up.
I've been paid for anaesthetic in the back
Oh
of my mouth.
no, yeah, it's a horrible, horrible taste.
It's so bad.
So sorry, you're gonna have to sip it and swallow. Remember, you're numb. Oh yeah. Thanks. It's difficult when you're that numb.
Thank you.
Is that all right?
That's fine, thank you. It's just a taste of it.
It really lingers as well.
So bad.
Let's pop you back again. Yeah, you've got cute little teeth. I'll show you them at the end if you want. All right. But 2 out of 3, like I said, it's done.
You can tell from the X-ray though, like, you know.
Yeah, they've got really big crowns, but tiny little roots. There we go. Okay, I'm going to pop the stitch in. And then if you could raise your chin nice and high once more for me. Turn away slightly, ever so slightly. Yeah, if you just pop it over towards me a little. Close a tiny bit again, just like before. Great. And then nice and wide this time, please. And just one more turn here. Yeah, if you pass me that, lovely. Yeah. Great. Lovely. Have a little breather there. Mm-hmm. Okay. Great. Okay for me to go ahead with the other side now. Yeah. So it probably will be quite a lot different to this side just because we need to open it up a bit more given that it's under the gum. Okay. And maybe some drilling involved, but we will take it as it comes, okay? Mm-hmm. Every tooth's different. All right. Okay, so let's check it's nice and numb for you.
It's so numb.
Yeah, yeah. Let's check to be doubly sure. So nothing sharp. No, and nothing sharp there? You can just hear me, that's fine.
Yeah.
At least we know. Glad you're still smiling. So, nice and high again. Turn slightly away from me. Great. Good, well done. A lot more pressure on this side. Great, well done. And then if you turn slightly away from me again, lovely. A lot more pressure, a few more funky noises. Bring you down a bit. So there's going to be a little bit of drilling with this one, okay? So vibration and water, just like having a filling done, okay? Oh, this chair, honestly, really hits me, doesn't it? Yeah. Don't even know why that one happened this time. There we go. All safe to swallow, but we'll use our suction as much as we can for you. Big as you can go, Min. Sorry, I know your jaw must be so tired. Yeah, just get the water. Lovely. Now if you suction back there. Are you okay? Mm-hmm. Well done. Good. So, bit of pressure here just to test the tooth. Good. Could I get some suction there, please? Yeah. And ignore the noises. There'll be a lot more on this side than there was on the other, okay? Well done. Good. Good. So it is moving very easily. So if you're okay, get the whole thing out. Okay. And suction again, please. And again. Good. which is really wobbly. It's just getting the space for it to come up and out and suction again. You're doing really, really well. It's coming. There you go, well done. Another little dinky tooth. So we'll give that really good wash out once again, just like before. Pop a few stitches in and that'll be you. Okay, you've done brilliantly, well done. You can breathe a sigh of relief now. All the hard work's done, all right? So nice big wide mouth. Lovely. Thank you. And seal around this.
Is it enough?
Yes, thank you. If you really retract there, yeah. Lovely. Thank you.
Maybe too long, the toothbrush.
Yeah, I can snip at the end, that's no problem, thank you. Oh. There we go. And again, yeah. We're just going to do one more. You can have a little swallow and a rest of your mouth there. Probably need it. This should be the last stitch and then that's you. You've got your mouth back. When you are ready. Lovely. Good. Great. Okay. Well done, Min. You've done excellent. You really did. Now, I'm just going to need you to bite on a couple of gauze packs just to help stop the bleeding, okay? And this is exactly what you do at home if it did start bleeding again, okay? So you get a bit of the gauze, we'll give you some to go home, roll it up so it's chunky enough for you to bite on something, and then we'll pop it over the socket, okay? You can dampen it with water if you wish as well, okay? But you're not bleeding very much. We'll leave that there for just a couple of minutes. So if you bite really, really tightly, we'll give your face a little clean as well, okay? We'll wipe you down, don't worry at all. Yeah, I do leave my fingerprints, so I'll give you a clean. Do you want to see the teeth? Well, they're whole. I can give them a little clean. They are a little bit bloody, I have to say, as expected, but we can show you them. Or if you want to take them home, that's up to you. No? Okay, good. Yeah, some people like to. I always have to offer. There we go. So they're all pretty much the same. A lot of the time wisdom teeth can be very different, but actually yours are quite similar.
Oh, they're so great.
Yeah, get rid. You're like, goodbye forever. Now let me just get rid of these sharps and then I will run through all the aftercare. Lovely. So at least they're all out. You know, there's no bits left behind. You don't have to think about them again after you're all recovered.
I'll give you the mirror as well.
And just get rid of the sharps here, all right?
Just keep biting.
There we are. So the sharps are gone except for the burr. Okay, no worries. Let me just give a little clean. Can I also get a prescription pad? Or actually, no, we've got amoxicillin, don't we, in stock?
I think I'll check it.
Yeah, would you just double check and then we'll get a box for 5 days, please? Thank you. Let me just wash my hands and I'll come explain everything. Is Jake at home today or at work?
He's working.
He is working.
But
He's gonna. Yeah, he'll be your nurse for the weekend.
Yeah.
I keep forgetting this is Thursday. I keep thinking we are straight into the weekend. It's because we've got a wedding this weekend, so we're going home tonight for it. So I keep thinking it's Friday. Lovely, thank you. I'll write that in a second. All right. So I'm just going to get you to keep biting on that for just a few more minutes. Everything I'm going to go through is written down, so don't worry if you feel like it's too much information, you're going to forget it. It is there for you, okay? But you need to take it easy for the next 24 or 48 hours. We don't want any exercise, no exertion at all, because any reason the blood pressure can cause the blood to pump around and cause that area to start bleeding, which isn't a worry, but we don't want that to consistently keep happening. So just keep it relaxed, put your feet up when you get home. And of course, you're really, really numb right now. And it's going to be like that for 3 to 4 hours, give or take. Preemptively, we want you to take some pain relief, okay? Because once the numbness wears off, it's going to be sore, okay? Likely this right side will be worse than the left side because it was more of a surgical extraction. We had to drill this side, we didn't on the other. So just be prepared with some paracetamol and ibuprofen. You're okay taking both of those? Yep. So they work really well together. It's up to you if you...
Sorry,
Yep. Yeah, you didn't want to keep them. No, we said goodbye. Thank you. So they work really well together. You can either say start with the ibuprofen, a couple of hours later take the paracetamol, and then when your next dose of ibuprofen is due, take that and stagger them, or just take them together. But they do work very well for this type of pain and work well together. I take that when you get home. You're probably, what, an hour away from home at this stage? You're going to get, right, okay. So once you get through the door, take that, because once the numbness wears off, you want that to have already sunk in a little bit. It is common to need that for about a week, but take each day as it comes. But the first 3 or 4 days are always the worst, okay? It kind of peaks with the pain and then it goes down after that. Similar with swelling. So you want to put a little frozen pea bag or an ice pack, wrap it up in a towel, over your cheek. Place that over there for about 10 minutes, both sides, twice a day. That just helps to reduce the extent of the swelling, okay? Yes, bruising is expected. If you like using arnica and things like that, you can, but bruising's bruising. It's gonna just have to take its time to recover, okay? Now, because you're numb, you need to be really, really careful when eating and drinking. Sip the water, swallow drinks that are cold, that's not a problem, but we don't want you to burn or bite yourself accidentally. So really, if you're gonna have something warm, let it cool down. Sort of like a baby's bottle. You'd always test the temperature before feeding them. You need to do the same with your food. And both sides are numb, both sides are gonna be sore, but you wanna have a soft diet. Like soups, stews, pasta, mashed potato, yogurt, ice cream's going to be really soothing, and cold, it's quite good in this scenario. So maybe stock up on those things. You'll know best when you're more comfortable to start having harder, more solid foods, okay? Now, it's normal to get the taste of blood in your saliva today. You need to swallow that. Like I said during the procedure, no spitting or rinsing for 24 hours. That means I'm going to ask you to wait till tomorrow to brush your teeth. If you really want to, and you're so, yeah, I know it's not a nice taste, brush your teeth, gentle around the back, let it drill into the sink, the toothpaste, don't be spitting. Okay, so that'll freshen your breath and the taste, but no spitting. That force could be enough to dislodge the clot, and the clot is the single most important thing for the healing process for 24 hours, okay? But after that, then you can start using you're not drilling, but I know it must feel that way. So after that, you can start using warm, salty mouthwash. So that's a teaspoon of salt in warm water. Swirl it around your mouth after meals. Do that 2 or 3 times a day for a week following the procedure, but that's from tomorrow lunchtime onwards. So 3 or 4 times, because you have 3 or 4 meals. Okay, so after each meal from tomorrow onwards. Okay. And like I said, you're going to taste blood, but it's only if the socket is actually bleeding actively with fresh red blood filling up the socket and into the mouth. That's active bleeding. That's when you need to intervene by putting pressure on, like you're doing right now. You didn't bleed much during the procedure. I don't anticipate that you will, but that's only as a precaution in case at home you find it starts again. And we'll give you some gauze packs to take home. Okay? Yeah, you've got it all kitted out. Lastly, I'm going to just give you a cover with some antibiotics. You know, you had 3 wisdom teeth out. There were a surgical procedure on the right side. It's just there. Now, you can start them straight away, or if you want to give it a couple of days and see how it goes, they can be used as an emergency dose, or just cover yourself and just take them today. Okay. You're not allergic to anything, you said. You've had penicillin before in the past? Yep, fine. So this is amoxicillin. Take it 3 times a day, so every 8 hours if you can. Don't worry if you're going to bed and you think, oh, when did I take it? Just take it, okay? But 3 times a day, and the dose should really be taken for 5 days, okay? If you came out with a rash or swelling, shortness of breath, then stop. It could be an allergy, but you've had it before. I'm sure you're completely fine, all right? So let me just get that prescription, take these out of your mouth, and then that'll be you good. But it's all written down, like I said, okay? Excellent. And today's date is the 16th, brilliant. Okay. this on.
Do you need anything else?
No, we got the prescription. No, you've got all of that. Thank you very much. Thanks, Vic. You're like, I'm just going to be drilling. At least you've got puppy cuddles to come as well.
Oh, God, yeah.
It's bouncing all around you.
Yeah, so bad.
That's
So
nice. We'll get you some water if you want. Okay, to have a sip. So it was 2 stitches on the left, 3 stitches on the right. If we didn't put stitches, it would eventually heal, but that's just to help it kind of recover a little bit quicker and bring the gum back together. But you will see it very quickly once I did the injection on that side, bruised in your cheek. So you'll see a little kind of like blood blister there. It just went straight away. Some people react like that. Yeah, lovely. That's not bleeding. It's really, really dry in there. No bleeding at all, as you can feel. Let me just get you your prescription and things. Okay. Now, my handwriting's not normally this bad, but writing on a box is very difficult. So 3 times daily for 5 days, okay? There is actually 7 days worth, but 5 days is the guideline dose, okay? All the instructions are written down here, and there are some gauze in case. Unlikely, but if you did run out of them, you can use kitchen roll, just wrap it up and make sure it's nice and chunky. Yeah, you're well equipped, so that's for you. Are you feeling all right? Yeah? Any questions at all? No? Well, we're on the other end of the phone if you've got any questions. Yeah, exactly. No,
so funny.
No, you did really well.
Thanks.
And just tell Jake he needs to be nurse, doctor all weekend. Put your feet up. You're not allowed to lift a finger. You can really take advantage of this.
So the CBCT we took, we usually have to turn them all off for reporting.